We are. Let's bring in our good friend, Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital. Good morning, Dr. Joe. Where do you want to start this morning?
Hey, Ray. How are you?
I'm doing well.
Good. Great to have you back.
Thank you.
This is our time of year. Everybody has their time of year, and this is our time of year. We can't get the young athletes in fast enough. Kids athletes are a lot of injuries. They need a quick answer. They want to get back out to play. This is definitely not, if you could come around in our office, not just a football thing. The soccer kids, the volleyball kids, the cross-country kids, everybody who's going into organized sport in August. One of the principles that I think we've talked a little bit about in the past is that 60 to 70% of sports injuries occur in the first 4 weeks of the season. So everybody starts early on. There's all kinds of breaking down and injuries that need evaluated. And there's a lot of reasons for that. Is kids will go into the season with a weakness, so they're a setup for injury, or a imbalance that they have in muscle tendon problems, or they'll have previous injuries that were untreated at the end of their last season, and then they get out and start practicing hard this season, and they get what we call unmasked. They'll start working hard, playing hard, and all of a sudden there will be a lot of injuries. But this is the time, lots of injuries. If you get past the first month, your chance is a lot better that you're going to get through without an injury, but not right now. And people want to know, can I play? Am I going to be done for the year? How many weeks? Coaches need to know to count on players. Players and families need to know. So it's our busy time of year. And one injury I wanted to cover that is unique to the young athlete, and that's why having a children's hospital and seeing these kinds of injuries for me 30 years, this is an injury that on a day like yesterday, I may have seen 5 or 6 of these. They're very, very common injury that occurs to mainly uniquely to young athletes. So this isn't going to happen in a 19-year-old, a 25-year-old, a 40-year-old. This happens in teenage athletes, particularly when they're growing a lot. So when a kid tells us they've grown 2 or 4 or 6 inches over the last year, or even over the summer they've grown a lot, you know the age range where they're getting this growth going on. Is they get an injury, and the trainers or coaches and things, it looks like if it was an adult that it was a pulled hamstring, or it looks like it is it looks like it's a muscle injury, and it's not one of those injuries. It is a problem with, and so these growth plates are attached, the hamstring, and it'll be high up in the bony area, or they call it a hip flexor. And my warning would be to coaches and parents and athletes, when they have a hip flexor or a hamstring that doesn't go away in a day or two, and most of it starts up high, like in the bony area, the very good chance that they have either a stress fracture or a pull-off fracture of these growth plates. And what happens is they just can't run, they can't sprint, and it isn't a day or 2 or 3 where it's getting better. If it's getting more than 5 to 7 days, get them to somebody who sees younger athletes, because this injury can be extremely frustrating, and it can be something where somebody misses the whole season when it's treated improperly. And in other words, kids can be back in 4 weeks with the proper diagnosis and rehabilitation. So these are growth plate injuries in the area where the groin attaches, the hip flexor, the hamstrings, and a very, very common youth injury.
And Joe, the growth plate also around the shoulder and the back area, huh?
No doubt about it. There's no doubt about it. They're basically everywhere in the body, over 200 of these growth plates. And it's what is kind of fun for us, because we kind of need to know the pattern of when these growth plates are most at risk. So some of them affect kids in the pre-junior high level, some in junior high school. These growth plates I'm talking about affect people most in early high school. And so we know those kinds of things. We know the patterns of injury, but growth plates are most at risk while these kids are growing, and then they go out and play sports. It's a lot of work on flexibility and strength, but if they actually have a fracture, there's going to need to be some rest period. And it's hard for coaches and people to figure, gosh, a little hamstring pull, why are they needing a rest period? And so if we can help diagnose these kids, they do very well.
All right, Joe, good information. Growth plate, keep that in mind if you're parents of teenagers. I've gone through that with my oldest. probably going to go through it soon with Rocco as well.
That's right.
Thanks, Joe.
Yeah,
Appreciate it.
Remember that younger kids are not just little adults; they have their own unique, and that's the key. And I think you understand that well. Thanks, Ray. Have a great week. Okay.
You too, my friend. Dr. Joe Congeni from Akron Children's Hospital joining us live this morning.